welcome to my YouTube channel. My name is Ongo Imwangi and I'm a Kenyan RN. This channel is Nursing with Koi and it's about educational stuff regarding nursing, the profession, experiences of patients, my own experiences, and basically patient teaching and health education. Today I come back with another video on polycystic ovarian syndrome or polycystic ovary syndrome. In short, it's called PCOS. I will give a brief overview and my story of PCOS. So stay tuned because it's going to get more interesting towards the end because that's where the story will come in. So let's dive in without wasting so much time. And if you're new here, please take your time to subscribe and hit the bell icon so that you are notified every time I upload an informative video such as this one. And if you're a returning subscriber, know that I deeply appreciate you. So let's dive in. So polycystic ovary syndrome, also known as polycystic ovarian syndrome, is a common health problem among women of reproductive age and is caused by an imbalance of reproductive hormones, and these are the female reproductive hormones versus the androgens. The hormonal imbalances creates problems within the ovaries, and these are usually in forms of cysts, and there are many of them. The ovaries makes the egg, which is then released each month as part of the healthy menstrual cycle. But with PCOS, the egg may not be developed as it should and may not be released during ovulation as it should be. It therefore turns into small sacs that are fluid-filled, which are then called cysts. So poly means many, cystic means having cysts. So having many cysts is in the ovaries is all about this syndrome. So it can be, PCOS can cause missed or irregular menstrual periods, and irregular periods can lead to either infertility or development of those small fluid-filled sacs in the ovaries. So to appreciate PCOS, we have to get a comparison between normal ovaries versus polycystic ovaries. And normal ovaries will have different follicles at different maturation stages and will not have the polycystic irregular lining, as you can see. And therefore, the first side on the computer, on the left side, we have a polycystic ovary, and on the right side we have a normal ovary. So the normal ovary will just be smooth, will not have the cysts, but when you do the cross section in the polycystic side, you will see this many cysts, and usually it gets heavier and larger. It can get heavier to a point where it is very symptomatic and the person can feel the pressure. So yeah, that's just a comparison of the two. So let's continue with this. So there are two principal definitions that are used today. One arising from an expert conference sponsored by the National Institute of Health, the NIH, in 1990, and it is called the NIH 1990 criteria. And the other one is from another expert conference sponsored by the European Society for Human Reproduction and Embryology and the American Society for Reproductive Medicine, and this was in Rotterdam in 2003. So this one is called the Rotterdam 2003 criteria. So the prevalence of PCOS among unselected reproductive aged women is at least 6.5 to 8% using the NIH 1990 criteria. Future studies must establish the prevalence of this disorder in different populations and using various criteria proposed to define PCOS. Finally, studies on the long-term development of reproductive and metabolic abnormalities in women with two new phenotypes of PCOS defined by the Rotterdam 2003 are needed to determine whether these have risks similar to the classic PCOS. So here we have a few surprising facts and statistics that are in the fact sheets about PCOS that we didn't know about. Frankly, I didn't know some of this before seeing this. And the first one is that more than 50% of women with PCOS have diabetes or prediabetes or impaired glucose tolerance before the age of 40. So that is very key to note, and I had a personal experience with this. I used to have issues with my sugars and issues with pre-diabetes pretty early in my life, and I had been put on treatment at some point, but then it wasn't real diabetes. So at some point then the treatment became too strong and my sugar started dipping. But anyway, that happens. Then we have 50% approximately of all women with PCOS will suffer from obesity. They will have either overweight or they will be obese. Then 70% of women who have PCOS have not had it properly diagnosed. They may not even know that they have PCOS in the first place. Then for the risk of heart attack in women with PCOS is 4 to 7% or times higher than in women who do not have PCOS. Then worldwide, PCOS affects 1 in every 15 women. So assuming, let's say, in a high school where we have 600 women of reproductive age, because that is what high school students are, because they are above 15, we usually say the reproductive age in Kenya is between 10 to 49. So in high school, those are women in reproductive age, and 1 in every 15 girls will have PCOS. So that is how common it is. Then let's continue. So the other question we need to ask ourselves is, who gets this PCOS in the first place? And between 5 and 10% of women between 15 years and 44 years during this reproductive age have PCOS. Most women find out they have PCOS in their 20s and 30s when they have problems conceiving. PCOS can happen at any time after puberty for as long as you are a lady within the reproductive age again. Women of all races, ethnicity are at risk of PCOS. It doesn't favor any race or gender. Sorry, it favors the gender basically because it only affects women, but it does not affect any race or ethnicity differently. Your risk for PCOS may be higher if you have obesity or you have a mother, sister, or auntie with PCOS. So it runs in families. So symptoms of PCOS include irregular menstrual cycle, either too soon together or too far apart, meaning they will be either very few in a year, less than 8, or very many, that is once every 21 days, one is seeing their menses. So some women with PCOS will not have menstrual periods at all the whole year, all round, so they don't even know whether they do have menses or not because they do not have. Then too much hair on the face, chin, and parts of the body where men usually have hair, and this is called hirsutism. It affects about 70% of women with PCOS. Then we have acne on the face, chest, and upper back, thinning of hair or hair loss on the scalp, and this is male pattern baldness. So basically, where you should have hair is not going to be there, and it's going to be thinning, and it's not going to be good quality hair. But where you should not have hair, you're going to have hair. So that is the irony with PCOS. Then you have weight gain or difficulty losing weight. This is a struggle for many people with PCOS, but at least nowadays there are measures and remedies, and people are able to lose a little bit more of weight. Then we have darkening of skin, particularly along the neck creases, in the groin, and underneath the breasts. So that happens. Then we have skin tags, which are small excess flaps of skin in the armpits or neck area. The exact cause of PCOS is not known, but most experts think it's multifactorial and genetics play a role. So the two main causes could be high levels of androgens, and androgens are male hormones. Although women can make small amounts of androgens, androgen controls the development of male traits such as male pattern baldness, and women with PCOS have more androgens than normal, and that's why we said one of the symptoms is that male pattern baldness. Higher than normal androgen levels in women can prevent the ovaries from releasing an egg or ovulation during each menstrual cycle, and can cause extra hair growth and acne, two signs of PCOS. Then the other classic symptom or causality would be high levels of insulin or insulin insensitivity or resistance. And this insulin is a hormone that controls how the food we eat is changed into energy. So like how glucose is converted into energy, and how this glucose will remain in blood, the amounts, because when there's too much glucose in the blood, then that's a big issue because you have hyperglycemia, and those are symptoms of diabetes. So insulin resistance is when the body cells do not respond normally to insulin, and as a result, the insulin blood levels become higher than normal. So many women with PCOS have insulin resistance, especially those who are overweight or obese, or unhealthy eating habits, and do not get enough physical activity, or have family history of diabetes, especially type 2 diabetes. Over time, insulin resistance can lead to type 2 diabetes. So personally, I actually had insulin resistance and I still had high levels of androgens, but the high levels were not very high. I had higher than normal testosterone, but it wasn't very high. So the drug that I was put was to control the insulin resistance. So I was put on metformin, and that actually did help. So the other question is whether one could still get pregnant if they have PCOS. And yes, having PCOS does not mean you can't get pregnant. I had PCOS and I have 2 children. PCOS is one of the most common but treatable causes of infertility in women. And in women with PCOS, the hormonal imbalance interferes with the growth and release of eggs from the ovaries, and that is a process called ovulation. If you are not ovulating, then you cannot get pregnant. And this was my main issue because I didn't have most of the classic symptoms of PCOS, but I had polycystic ovaries in one side. I had one good ovary and one was polycystic, but still I was not ovulating as I should have, and that is why there was a delay. So that I was put on ovulation treatment as well, and that did help, but it took a bit of time. So your doctor will talk with you about the ways to help you ovulate and raise your chances of getting pregnant, and you can use those apps on the phone, calculators, the ovulation calculators, to see if you have the fertile signs. I did learn in great detail the natural family planning methods, because if you're able to understand the natural family planning methods, they are usually based on the natural menstrual cycle analysis. So you will be able to tell fertile mucus, infertile mucus. You will be able to tell when you have actual ovulation and when you don't, if you understand them properly. So I might do a video on that someday. But that is something you can educate yourself on, because if you're struggling with PCOS and getting pregnant while with PCOS, it is possible to not use any treatment. That is medications. You can actually use home remedies and still conceive. So PCOS have been linked by different studies to be linked to other health problems, and these include diabetes. I had talked about type 2 diabetes, and more than half of women with PCOS will have diabetes or prediabetes before the age of 40, and they need to actually know how to control this with diet and modifiable risk factors to avoid it. Then high blood pressure. Women with PCOS have greater risk of having high blood pressure compared to women of the same age without PCOS. High BP is a leading cause of heart disease and stroke, and therefore one should really educate themselves and see what they can do to prevent themselves. I had covered hypertension, and I'm going to highlight it up here so that you can actually check it. Then unhealthy cholesterol. Women with PCOS will always have higher levels of bad cholesterol and low levels of good cholesterol, and this raises the risk for heart disease and stroke. And then sleep apnea. This is when momentarily there is momentary and repeated stops in breathing that interrupts sleep. So you are sleeping and then you forget to breathe. This is a common thing in babies, but even with women with PCOS, they get this symptom. And usually those who are overweight and obese, and this increases the risk for heart disease and diabetes. Then endometrial cancer, problems with ovulation, obesity, insulin resistance, and diabetes, all common in women with PCOS, again increase the risk of developing cancer of the endometrium or the lining of the uterus or womb. I had also covered endometrial cancer. You can refresh your memory on the same. Then depression and anxiety are common among women with PCOS. So researchers do not know if PCOS causes some of these problems or these problems causes the PCOS. It could be vice versa. But there are conditions that cause PCOS other than health problems, and we are going to see about them. So another question is, will my PCOS symptoms go away at menopause? The answer is yes and no, depending. PCOS affects many systems in the body, and many women with PCOS find that their menstrual cycles become more regular as they get closer to menopause, or it gets better with age. However, PCOS hormonal imbalance does not change with age, and therefore the symptoms of PCOS could continue. Also, the risk of PCOS-related health problems such as diabetes, stroke, and heart attack increase with age, and these risks may get higher in women with PCOS than those without. When it comes to diagnosis, there is no single test to diagnose PCOS. To help diagnose PCOS and rule out other causes of symptoms, the doctor will have to do a wide screen of the same and do a complete physical examination as well as complete medical history. Different tests may be requested, and beginning with the physical exam, depending on the findings, then they are going to proceed to other things. They could do a pelvic exam after the physical exam, and this is to rule out signs of extra male hormones, check to see if the ovaries are enlarged or swollen, check to see if there are fibroids, because that is something that you can actually check by abdomen by palpating and all that. Then you can do ultrasound, pelvic ultrasound, either transabdominal or transvaginal, depending. Transvaginal is actually better because it gives a more detailed, clearer picture. Then you can also proceed to other imaging tests such as MRI, CT scan, depending on the findings of these other tests. Then blood tests you can do a whole complete blood hormone profile, and this is to check the level of the hormones and if they are in the healthy ranges or you have presence of increased androgens. Other things that could be checked is the thyroid function test, the kidney function test, the liver function test, just to rule out any other causes of those symptoms. Once other conditions have been ruled out, you may be diagnosed with PCOS if you have at least 2 of the following symptoms. 1. Irregular periods, including periods that come too often or not often enough or not at all. 2. Signs that you have high levels of androgen, especially hirsutism. Then we have 3. Extra hair growth on your face, chin and body. 4. Acne. 5. Thinning of scalp hair. 6. Higher than normal blood levels of androgens. And 7. Multiple cysts in one or both of the ovaries on the scans. There is no cure for PCOS, but symptoms can be managed, and you have to work out with a customized treatment plan for you with your doctor, with your gynecologist or your obstetrician, whichever it is. Plans of having children, especially if you're dealing with infertility, again, that goes with the plan of the day depending on the symptoms presenting. Many women will need a combination of treatments that include either home remedies or medications. So when it comes to the treatment options of polycystic ovarian syndrome, it is important to think about the symptoms, the tests that have been done, and the treatment for which symptom. So when polycystic ovaries have been found in an ultrasound and there are more than 12 follicles and there's an increase in the ovarian volume up to 10 liters per ovary, then fertility drugs will be done if fertility is desired or someone wants to conceive. And it is also important before they do this, they go back down in weight. If they are obese or overweight, it is important to try and lose as much weight as you can before you conceive, because once you conceive, the weight will continue increasing and can get really high, and it might be really uncomfortable for you. Then 2, we have irregular periods, and for this, the test for this is just basically menstrual history. If the cycle is that comes above 35 days or every 21 days, that could mean polycystic ovaries or this syndrome. So for this, combined oral contraceptives can help to regularize the cycle and help. And this can actually, once the normal menses return that are regular, that is 28 days or close to 28 days per cycle, then you could actually conceive naturally. Then hirsutism or facial and body hair, acne or alopecia. There are different tests that be done on the hormonal profile, and for this again contraceptives could be used progesterone treatment could be used. Insulin sensitizing medications such as glucophage or metformin could be used, and that helps for that point. And if it does, then the hair will disappear and it will appear where it had gotten and should be. Then we have irregular ovulation and reduced fertility. Again, IVF stimulation drugs can improve fertility and help conception naturally. And basically, all you need to do for these tests include the hormonal profiles, test the estrogen, progesterone, FSH, LH, and test if there are androgens presence, especially testosterone. Then we have obesity, rapid weight gain, difficult to lose weight, and this could be related to insulin resistance. So you also need to do a lipid profile, blood sugar, monitor thyroid function test to detect hypothyroidism. So for this, you can do behavior modification, especially for modifiable risk factors. Eat healthy, exercise regularly, and go for your well woman clinic, as well as use drugs to reduce insulin resistance such as metformin, and that would help with the weight loss. So home remedies include losing weight, having healthy habits, and regular physical exercise and activity could help PCOS related symptoms. Sometimes all you will be told to do in your fertility journey is to lose like 5 kgs, and that would make a big difference. This would also, the better eating habits or the healthier eating may also lead to the body being more sensitive to insulin, and this will balance the hormone levels, and this could actually help with the weight loss as well. Then removing hair, where we have those facial hair, let's say you have a beard, you have, hair in the places where women normally don't have hair, then you can use hair removal creams, you can laser hair removal, you can do different other things to remove the excess hair, but then it may not be covered by the insurance. It is not the major concern of this, because it's just for aesthetic purposes or cosmetic purposes. Then slowing hair growth, again, this can be given a prescription to just ensure that you do not continue growing the beard, especially if that is, I think that is the most is the worst place that hair could grow in a woman, because it is just right there in the face. Everybody can see you have a beard and people talk. When it comes to the medications that treat PCOS, we have the birth control pills or hormonal birth control, and it could be the patch, the pills, the shots, or the vaginal rings, or the intrauterine devices. This would help in making the cycle more regular, reducing the risk for endometrial cancer, and helping improve acne and reduce excess hair on the face and body. So this could actually be very beneficial. And then anti-androgen medications, and this medication block the effect of androgen and can help reduce scalp hair loss, facial and body hair and acne. They are not approved by the Food and Drug FDA but to treat PCOS symptoms, but they are usually used. Then we have metformin, and it is often used to treat type 2 diabetes, but may help some women with PCOS symptoms, especially where there is insulin resistance. So in the event that one wants to get pregnant and they have PCOS, they would try losing weight, try fertility-inducing medications such as clomiphene or letrozole. They could also do in vitro fertilization where all other things did not work, or surgery. There's a surgery called ovarian drilling that could actually stimulate the ovaries to stop making the cyst and actually make the ova. However, if I was actually given that option, the last two, but I opted for IVF, but I did not get to do it. Thankfully, something just worked and I got the results I was looking for. However, I have a friend who did the ovarian drilling, and even now they haven't managed quite yet. So they are now working for in vitro, and they might have to consider using donor eggs. So I do not know whether it actually does work. Probably it does for other people, but I don't know whether it really does work, because the people I know who have done ovarian drilling, most of them do not have success stories. So how does PCOS affect pregnancy? It can cause some of the problems because it makes women have higher rates of miscarriage, gestational diabetes, preeclampsia, and C-section. And the baby also may have a higher risk of being heavier, that is macrosomia, and spending more time in the neonatal intensive care unit or the NICU. So how to prevent problems from PCOS during pregnancy is basically trying to lose the excess weight before you get pregnant. It is quite hard to lose weight after pregnancy, and especially that period of pregnancy, you may gain too much weight as well. And for me, this is where I think it really did affect, because I began my first pregnancy at 50 kgs, but by the time of the delivery, I was at 85 kgs. So I added a whopping 35 kgs. So shedding off that weight wasn't easy, and I am not in the healthy weight range, but I struggle, but I still lose a bit of weight. Coming to the second pregnancy, I began at 60 and I went all the way to 93 kgs. So you can imagine the weight gain. So imagine I had not lost the first pregnancy weight. I was still in my 80s. I would have gone to 100 and something kgs, and I'm pretty short, so that's a very unhealthy BMI. I am still not in the correct weight range yet, but I am still working on a few things here and there. Again, the struggle with sugar levels. Healthy blood sugar levels. Before you get pregnant, if you can do healthy eating habits, regular physical exercise, weight loss, that helps. Metformin also helps. Although, for some reason, you will crave sugar like crazy. I do not know why. I do not know the reason. Because when my sugars are really bad, that is when I really want sugar. When I stop taking sugar, and it takes about 2 weeks for me to get over sugar, I can actually stay without taking sugar comfortably, and especially when I need to. But there are periods where if I have not had something sweet, I just feel so lethargic and I am just craving sugar. However, it gets better with time, because if I complete a whole 2 weeks without having anything sweet, then it is actually possible to stay without sugar for a longer while. So that's a big struggle, but that works. I know someone may have a similar experience with this, but I don't know. Then taking folic acid, and for me, I had to take a number of prenatal vitamins. And I started way before the pregnancy and continued way after the pregnancy. And this actually really did help. After my firstborn, I think most of those symptoms that I was experiencing, even the cysts that were there, the polycystic of that ovary that I had talked about, reduced in size and volume, and the cysts kind of dried up. I had less and less cysts than they were usual, so it wasn't very hard conceiving the second time. I did not need so much of treatment then. But then the folic acid, you may need more than folic acid. I feel like you need all the vitamins you can find. For as long as the supplements are not illegal, you could actually get as many prescribed for you as you can, because they actually do help. They make you feel even better, and I was able to even get my blood levels to the right range. I remember I used to struggle with my HB always being below a certain level, because I also had fibroids that were bleeding. At some point I had a HB of 6 point something, but nowadays my HB is always ranging between 10 and 14, around there. So the prenatal vitamins, if you take them before and after, they are quite helpful. I do love the ones from Vitabiotics because they are quite balanced. The level of this, even folic acid, is very low, but they say that's the ideal. So it could actually work for someone else, but that actually does work for me. So for these presentations, these were the references that I used to prepare that content. Thank you so much for watching and listening through. I will proceed next with my story of PCOS and conception. So my story goes like this. I had not known that there is something. I had gone through, like I had studied PCOS in class, but it is not a major condition, so it was just brushed through. And I passed my university and I started working, and I continued with life, and I actually even forgot about this condition called PCOS until after I got married and stayed a few years without conceiving. So, you know, there's that point where people are just expecting, and it's a funny thing in Africa where you just got married and everybody's looking at your tummy. The next meeting you find, or you attend a wedding or a burial and everybody's looking at your tummy and they're like, you are still not pregnant. I remember there is a family member who even wanted to tell me how one gets pregnant, you know, like, what is it that you're not doing? Anyway, now I went to this doctor and he first diagnosed me immediately with PCOS because he asked me to do a scan and a few other blood works, and he was sure this is PCOS. However, in my head, I thought this cannot be. I do not have any of those symptoms. I did not have any of those classical symptoms except for my heavy menses. But then they were regular in nature. They used to come between 27 and 29 days, so that is still within the regular cycle. So I didn't have any other symptom other than that. But then now when we did the hormonal profile, I had a raised androgen level. My testosterone were high, but I still had close to healthy levels of estrogen and progesterone. They weren't really in the normal range, but they were just slightly lower than the usual. So anyway, so that is the journey. It began around there. I was put on treatment and that continued. But then later, a few months later, I sought a second opinion, and this other person was like, no, this is not PCOS. There's no way you have PCOS and you don't have acne, you do not have, I actually do not have any makeup on my skin. This is my normal skin. So it was even better then. So it has just always been smooth. I have had dry skin all along. So I basically never suffered acne even during puberty because this is dry skin. So I never had acne, I never had obesity, I never had overweight issues. I did not have anything that you could actually tell that my voice is not as hoarse or deep like the way they associate people with hirsutism. I never had hirsutism, I never had any of those symptoms. So this other doctor is like, no, we need to do more tests. So we do more tests, and then they're like, no, what scan did you do? I said a pelvic scan, and it was transabdominal. So he told me to do a transvaginal one. So I do this transvaginal one, and then his HSG, and this is when they discovered I also had submucosal fibroids. So now I began treatment for these two, and then I got to a point. Now he started now giving me timelines, like, if you haven't conceived in the next how many months, we may proceed to do ovarian drilling. So I had been told about ovarian drilling, and I had done a lot of research about this, and therefore any person who mentioned ovarian drilling to me, I just ran, like that thing that makes you just run. So I continued, I sought a few, it wasn't 2 opinions, it was about more than 10, because I remember there's a time I thought these people must be lying to me, they have other agendas, but it is that denial, you know, deep down in you. And finally I got to accept, but it wasn't until I met a lady in Nairobi who had experienced symptoms, and our cases were quite similar, and therefore she told me there's something called lean PCO and not lean PCOS. So I had PCO because my ovaries were polycystic, one of my ovaries, not both of them. But then I did not have the syndrome. The syndrome is that now syndromic management of all the other things, except for the raised testosterone and the lower than normal estrogen and progesterone levels. So to fast forward the story, I get treated, I wait, I do other tests. The rest of them are all clear, and now we get to the point where I was told now it is either IVF or we do ovarian drilling. So at this point I'm like, no, I am not going to do surgery, I am not going to do either of those things, but I may consider IVF. So, and I say now I want IVF, and we start planning for IVF and start saving money because IVF doesn't come cheap. I did not even know that NHIF covers for IVF until way later, and we I found a number of resources online, and especially Facebook. I'm very thankful for a group called DTC. No, sorry, Waiting Wombs. Waiting Wombs Trust is a group that has women of all ages and gender who have not conceived for a certain reason or the other. But then with that support of the resources that are shared there, you get to learn more about almost every other condition affecting fertility. So now that I was dealing with 2 of these conditions, I got the treatment for fibroids pretty quick, and that was solved. So now the PCOS took a bit of time. But then when I was working on saving for my IVF, I decided to take a break. You know, the way you just are tired, you have gotten to the point where you just don't even want to hear anything about fertility. You do not even want to think about babies, and we are like, okay, we are just fine this way. Let's just take a while. So I just wanted a break of like 2 or 3 months without having hearing anything to do with pregnancy, getting pregnant, or trying to get pregnant. So when I take this break, it didn't even last me 3 weeks. Then I missed my first period, and my periods were regular like clockwork. There was never a month that I had missed menses since I was like 14. So now I get no menses, and then I start experiencing symptoms of pregnancy. But because of the many times you take pregnancy tests when you're trying to conceive, I decided I will not take. I decided I am giving myself a break. I am not going to take any of these treatments. I'm not going to think about those baby things. So then at some point I feel something, and I'm like, no, I think I'm unwell. So then I decided to take a test before going to hospital, and that confirmed that I was expecting. So I do a few tests, and I went to the usual doctor I used to go to, and then he's like, yeah, you're expecting, but now pregnancy with PCOS is high risk, and do not even tell people you're expecting, because it may not even get to 24th week where now we can say this is a viable pregnancy. So wait for viability before you even tell people. So that made me even feel more sad for this situation, and actually made me not go back to that doctor. I changed, and I looked for a different person in a different place just to hear different opinions. So, and I did not tell him all this history about PCOS or fibroids or whatever. So we began as though it's just one pregnant lady seeking obstetric care or treatment now for their pregnancy, to be monitored and to be helped through. So I did not tell this other person about all this history until way later. And the pregnancy worked out. There was return of fibroids somewhere during the pregnancy, and then the fibroids again went away during the second and third trimester, around there, close to the third trimester. And then yeah, I got my baby, and then sooner after, like 2 years after the first baby, I got again pregnant. This time it was just natural conception, because for some reason clomiphene does not work for me. Letrozole is what helped in the first one, because I think that is what I was on before I decided to take my break. But I don't know what exactly helped, but that helped. So that is a short story, and once you have ruled all other things, and if you're going through the TTC journey, do not despair, do not give up. It will happen. It will happen. We have seen people having waited for several years and then having their miracle baby in the end. So from this and much more stories, thank you so much for listening all through, and bye.